The biggest mistake or talks in the beginning, I would say, what do you need in the hospital versus what you may want in the hospital. So there's certain items that you obviously have to have. Now, what you don't want to happen is if there's a tight budget, you don't want to just start cramming and making spaces smaller than they should be, just for the sake of getting the spaces. Because there are certain dimensions and working areas and dimensions that you really have to have in terms of how much space for the client to sit, how much room for the veterinarian to work at the exam table versus behind them. So you get a space too small and it's really becoming not functional, and then you're getting into, you've got the space there, and if you can't use it, then it's not utilized properly. Also, you may have to have multi-purpose spaces where you can double up, and maybe that third exam room that you would like to have but just don't have the space for, that gets doubled up as a grieving room, possibly an office. So you really need to prioritize what you need in the facility and what's more important. Now, the other thing is, if it's a budget right now, but maybe in the future that you'll expand or you'll add on so many more exam rooms or an extra surgery suite or a table or more treatment tables, then it's very important to know what that plan is and even plan for it on paper, so that when the time comes to renovate or do the addition, you're now not having to destroy part of a room that's not relevant to the project because it's in the way of the future expansion. So careful planning can give you what you need at the present time, and then allow for an easier transition for expansion down the road.